right now I'm gonna be totally honest and say I just turned the video camera on and I know what I want to talk about, but it hasn't been thought through much, and I'm just gonna go along with it. And basically right now I'm kind of in a debacle, a medical debacle, of course. Just things, my friend the other day was saying, she's also on YouTube, Emily's Life on Wheels, how things to her, like medically, have always been pretty cut and dry, and like if she has a symptom, it's like not too hard to figure out. And she just had like her, I don't want to say first, but one of the rare times when she was experiencing a problem and the doctors were like really confused and had no idea what it was, for only a few days, but it was still like she wasn't used to that kind of thing. And I was saying to her, like, it's so the opposite for me, because I'm always used to being the mystery patient, the one whose blood work doesn't quite make sense and doesn't follow the trend, and I'm always like the outlier and I don't follow the rules. My body does different things, and I got some blood work back a while ago that suggested all of these things, and it made so much sense, and I felt a lot of validation, which happens a lot when I get test results, no matter what kind of test it is, and they come back showing abnormalities, and it's like, finally, this explains what I've been feeling. Even though I've got great doctors that know I'm not lying, you know, in the past, I've always had to fight for, you know, this is real, this is my symptoms, I'm not faking it, I'm not faking my seizures, I'm not faking my pain, you know, I do have Lyme disease. All that nonsense before I was properly diagnosed and had good doctors. So I feel validation is just like so important for people with Lyme disease, because we're often not validated a lot. So I felt really validated by these test results, not only, and then I had all these symptoms that went right along, and like you Google it and it was like textbook, you have this, is it from Lyme disease, tick-borne diseases, or is it unrelated, did I have it before and it's spiking due to these? That we don't know, and we would only know that when we continue to treat Lyme disease and Bartonella. I'm going to be doing a Bartonella homeopathy. I hate it so much, but it makes my skin break out like crazy, and it makes me herx, but that means it's working. So Bartonella Desbio, and like if those symptoms went away, then you see like, oh well, the cause was really an underlying thing, or no, it's still prevalent. And with autoimmune conditions, I still have like, I'm still iffy about not knowing. I know a lot of my, like, really all my problems are from, you know, having chronic strep, like the Epstein-Barr and the Lyme disease, the Bartonella. They just found I had another tick-borne infection, and it's like, I forget which one it was called. I can't think of it right now. Babesia and another one, and now I got more extensive blood work, autoimmune blood work, and everything came back normal. And I'm like, So I had this one, autoimmune, but it wasn't as in depth. And it was like, everything was like red, like everything was wrong. And then I have this one, it's like all green. So I'm like, what the heck? So it's like, what's my diagnosis? Like, what? It's, they don't both go together. So, and I really thought it was going to. And does that mean like you don't have that problem? Does it mean it's just more mild? Like, do I base it off of my more clinically symptoms? But I still have this blood work that shows all these things are wrong. But yet when we went into more extensive blood work, different things didn't show up. So I'm like, so how important, what role does that play? Does that mean I don't have a disease? Or it's just so confusing, and it's so frustrating, because right when you think like you have like an answer to something and something makes sense, and you're like, now it's like, oh wait, that doesn't quite line up. And it's like, of course it doesn't, because I'm Cassidy and I am I don't even know, fill in the blank. I'm Cassidy, I am medical, don't follow the medical rules, and I'm not textbook. I am not a textbook case in anything, and this just proves again. I'm like, should have prepared myself for this, but I didn't. Really expected the blood work to come back like with a lot of red things, you know, showing problems, and me going, okay, well it matches up, it makes sense. I don't want to have problems, but then you can work on treating it, and you know what's wrong. And now I'm just like so conflicted. Like, are they even gonna treat me for like do any treatment? Are they gonna say I need any treatment differently than what I'm doing? You know, I have like all these symptoms, and like there's nothing else we can do to help like my joint pain. And sometimes I wake up and I can't even hold like a cup, or I can't like, I couldn't pour cereal, I couldn't grab a glass, I couldn't, like my hands wouldn't do it. They weren't strong enough, and my joint pain could be so bad that I'm like crying in bed, and it's like Advil doesn't just take that away, and I'm not good on narcotics, so that's not really an option. So it's like, great, now what do we do? For now, soon, I don't know exactly when, but I'll be starting more Bartonella treatment, continuing to detox, continuing to do meditation just because it's good for me, and because I have some other, you know, chronic stressors in my life that aren't health related, and, you know, doing things with Sonoma, getting out of the house, getting fresh air, you know, those easy things you can do, taking my medication obviously, and resting when I need to, going along with that. But it's just, it throws you for a loop, it really does. And it's hard because a lot of doctors have conflicting opinions, especially when I have some doctors, like I have a naturopath, I have doctors, and then I have like, doctors that do functional medicine, which is like a combination of herbal things, like the Bartonella homeopathy is from that doctor, and medications, like, and supplements, and it could be, you know, something else like acupuncture. And then I have the other doctors that, like, don't think that just, like, do blood work, and diagnose and just do, like, drugs and don't talk about, like, nutrition or anything like that. And it's just really confusing. It's good to have different opinions and then have, like, your gut and say, like, this is what I'm gonna go with. And I have really good intuition and really, like, yeah, I really feel that this is the approach I want to do. And ultimately, I do get to make the decision of what treatments I'm going to do and what I'm like, nope, I'm not feeling that medication. I don't want to try that. I don't think it's going to help. I think the risks are worse than the possible benefits. But it's just so complicated and it's very frustrating. So I guess there'll have to be a video after this when maybe I have some more, I can shed some more light to this situation and process it a little bit more. So that was my spiel of just what's been going on with some just different things that thought were gonna line up because it was going that way, and now we're kind of like this, kind of like that. And it's kind of like, where do you go? But we will figure it out and we will do what we think is best for me. And then we'll just continue on day by day.